Can you share a little bit about yourself and the type of shoulder pain you were experiencing before working with us?
Well, I'm Ariel. Last name is Avila. I'm a registered nurse here in the state of Nevada. Every other year, we have what we call a homecoming from the college that I actually graduated
Yeah.
from the Philippines. So all of the graduates, all of the alumni, we actually gather in, especially here in Las Vegas, and we do our uh like sports fest. So I tried to prepare for that. Unfortunately, I hurt my shoulder. So, and that was the main reason I contacted you because I couldn't do anything, even outside work, like my activities of daily living, right? Like just, you know, even lifting, whatever, like this one, I couldn't even do that. So now I'm doing it with my left hand or left arm. So
Yes.
anyway, that's the main reason I reached out to you. I saw your page in Instagram and Facebook.
Yeah.
I'm very thankful the algorithm actually showed me to those exercises because I went to a therapy for 3 months and it didn't do anything for me.
What was different between like our approach and the therapy that you were maybe doing for those 3 months?
So this is not my first rodeo that I actually hurt my shoulder. I hurt my right shoulder the last time with the sporting activity as well.
Yeah.
And that exercises that they've shown me or they actually instructed me to do, that helped. Okay.
Yeah.
It actually brought my shoulder to the the normal range of motion that I had before. But when I hurt my shoulder, but it's different pain. Before the frozen shoulder, it's more on my scapula here.
Yeah.
But right now it's more on the front.
Yeah.
But I wondered, I'm not trained as a nurse. I'm not trained for those exercises or rehab.
Right.
So when they showed me all those exercises, I was like, oh, it's the same from the last injury that I had. So I was doing that one like, religiously at home, the one that they showed me, like this. I do the same band exercises. For some reason, it's just, aggravated the pain.
Yeah.
The pain just got worse. And I gave up. They discharged me, and they said, "Oh, it looks like from because when they did the range of motion, right, the angle, right,
Uh,
before it was just right here. I couldn't even. Then when they reassessed me, I could do like halfway, and they thought it was all good, right? But
so frustrating.
I just noticed that I couldn't even drive like this, and I was like, "Oh, it's not." And then I went to my primary doctor and say, "Hey, the pain is coming back, and now I think it's worsening." And then she said that, "Okay, I'm gonna refer you to a chiropractor,"
Yeah.
which don't trust chiropractor. I'm so sorry for all the chiropractors out there.
Yeah.
It's just that I think they will, give more injury than than relief, right? So that was my mentality as a nurse anyway.
Right. Right.
So and then I just gave up. I didn't go to the chiropractor, you know, and because I believe it will not help me, they gave me I don't know, it's like 60 tablets of ibuprofen 600.
Oh
I didn't take
my
that
gosh.
one. I'm not a big pain med, person. I'm like more of a rehab kind of guy. And then I suddenly came across with your videos.
Yeah.
And it seems that you're a nice guy. It's like,
I'm not that cool over here, but I appreciate
like the credibility and stuff. The way you explain it though, because I'm an instructor as well.
it.
I teach new nurses here in our hospital.
Yeah.
So I still have like 4 hour work there to just to teach the new grad and student nurses.
Yeah.
The way you actually, like shared, the importance, the anatomy,
Mm.
and I was like, it makes sense how you do that. Like if you have a shoulder impingement, because that was the diagnosis I got from the CT scan that they did, it whatever you're saying in your video just makes sense.
Yeah, like addressing above and below the joint with a lot of those things.
Right.
Hey, there was something that you were experiencing kind of before, and I want to touch on this. What were you experiencing with sleep, like, before we started, and, like, what are you experiencing now with sleep with the shoulder?
Bro, I couldn't even I'm so sorry if I called you, bro. I was just
Oh, you're good. You're good,
I'm
man. Let it
just afraid now, bro. So anyway, I can't even sleep on my left side. I in the middle of the night, like constantly 2 a.m. And my wife is saying, "Oh, why do you keep on moving?" And I was like, "I'm trying to find the perfect position,
Yeah.
to help me, to sleep well." For 3 months, I had that for 3 months, and then I came across with that ball tape.
That was wrong. Yeah.
It's like a generic approach, for shoulder pain.
Yeah.
For the first few weeks, it helped, but it didn't actually like touch the pro. For the past 3 months before I actually get to your program, that's the way I slept, right? With like restraint.
Yeah.
I feel like a silent
That's
patient.
the shit. Yeah. You got the straight jacket on. That's what I'm kind
Yeah, yeah, yeah,
of just can't move.
yeah.
Straps. Wake
Exactly.
up. Oh,
So,
that's
so basically, it didn't help.
so you saw like the physical therapist, and then obviously you worked with us here. What was different from like the assessment side that we broke down? And then maybe, yeah, let's start there. What was different from the assessment side?
You introduce, a little of your program, the exercises, the 2 exercises, right? The
Cut.
chin thing, the chin tucking, and then this thing, right? And you can actually, you see that one, man? I was like, it's just nothing. Like it's like a normal, no.
Yeah. Whether you had 80, 90 to you had like eight, it was either 80 or 90% improvement by us doing some of those neck exercises on that call. And you were able to get your shoulder in all those different positions. So that was the frustrating thing. It's like, do you have impingement? Yeah, you might have impingement, but you wouldn't have drastically changed that quickly by us addressing the neck and that median nerve with.
The approach actually after that is actually different. Like how you made some exercises for me to do in less than 1 minute, and I could basically having changes with the range of motion already.
That quickly.
Those are the things that I would probably say that makes this program, like, I would say, more credible.
Yeah. What did you think the way that we structured your rehab program compared to maybe like some of those banded exercises you were doing in the physio before?
Well, your program is, I would probably say well structured, systematic in a way that, going phase by phase.
Yeah.
It started with I would say, an easy exercise, but if you have a shoulder injury, that easy exercises, terribly hard. I told you, right? The angel was not so angelic.
Oh yeah.
I was like, what the heck was that? Like this? Man, look at this and this and this.
Oh yeah.
Hey,
Yeah. Full motion.
so the first time I did it, I was complaining. Hey, doctor.
What kind of hyper this? My range of motion.
Oh my god. So yeah, and I believe that was the thing with your program. It's more structured. You on the first week, you try to focus on one movement, and then you introduce more challenging exercises every week. So I think if the program, I mean, it's progressing,
Yeah.
and then you would see your improvement.
How you're responding. That's how we responded
Yeah.
with it. Absolutely. So to kind of follow that up, like, what did you think of like the communication and back and forth throughout, like with the app and everything?
I mean, with you, I mean, I'm speaking because of my experience with you, right?
Yeah.
Even though it's just more on texting and more on the social media thing,
Yeah.
um, I'm pretty satisfied with it, because you're pretty responsive. Also, the video that you uploaded with the exercises, it's pretty easy to understand. What I like about that video, I think that was the one that, the instruction with the video. I think I consider that one as communication as well.
Absolutely. All that.
So different angles of the video,
Yeah.
so I could focus more on the movement, because some angle it will actually tell you, especially the, what do you call this, the thing, I forgot that one,
Is it the
like the punch thing.
stuff punch? Yeah. Yeah. It's it's
So
hard to
that was one of the hardest part, but because of the angle that she showed, right, I could basically focus on the movement, how I'm going to do it. I
J
think that
Yeah.
for me, that's also a part of the communication process, the video that you uploaded and the way you shot those videos. And also every every phase you sending me like a long message, hey, what do we do with now? What's your progress now? And stuff like that, you know? So I
Absolutely.
like that.
Yeah, absolutely. Talk to me about some of the basketball wins, man. Those videos were freaking awesome to watch. Take me through like, where you were at before with basketball and then like, stuff you're doing with your son.
I couldn't even play. I couldn't even hold the basketball. It was really frustrating for me because I love basketball. I've been playing basketball since that's my outlet, bro. Because in the Philippines, if you're going to Google Philippines and basketball, it go together, hand in hand. Even though we're short, but it's the desire, bro. It's the heart,
Yeah, absolutely.
and that's so frustrating because that's the part of my son and I. We used to play, and because of the injury, we are out. The park here is like walking distance from our place,
Yeah.
and you as an active person, and then suddenly it taken away from you. It's like it taken away a part of you, and the bonding moment from your son. And my son is growing; he's already 14, right? So that one is actually the saddest part for me. But the good thing is like I think this not the second week, but so the third week I started to have like an improvement in my range of motion, and then the second month, if I'm not mistaken,
Yeah, it was like around like week 5. Well, I had a pod
yeah.
you where you s
So
we,
I tried everything. I tried the anaconda shoulder brace.
yeah.
So I felt the improvement, right? And then I bought that anaconda shoulder brace. I wore that one, and then we played basketball one on one. The first time I played, I uploaded the video.
Yeah, I saw that.
I beat him, man, on the first game.
One of the games. He got you on the next team, but you got him on that
And
first
then
one, right?
he got me on the next two though. But bro, the confidence I got, and I was like, shoot,
Yeah.
this is it, man. I was like, you're the real deal. I was like, and then I started following your Instagram and your Facebook, and I saw if there any naysayer there, I'm ready to say,
Battling for me. I appreciate that in the comments you're saying. What would you say, like, your key takeaways that you're gonna take with you for the long term in regards to, like, your shoulder health from everything that we've kinda gone through so far?
well, this time regarding this injury, now it's an awakening for me that not all shoulder injury is actually the same.
Yeah,
Exact, and
so true.
especially I'm 51 now. I'm turning 52 this year. I'm trying to stay active. You don't have any problem until you have a health problem. You know what I'm trying to say?
100%.
And part of me is the the movement. The shoulder is actually one of the things that you have to consider. If to all the people out there, it doesn't matter what age you are. You could be healthy, you could be old, you could be young.
Yeah,
Man or woman, it doesn't matter.
yeah.
An injury is an injury. You have to take care of your health at first, and then you have to make sure that if you're doing any exercises or any movements, you have to take care of yourself.
What would you say to someone who's hesitant about starting a virtual shoulder rehab program with this?
Well, to be honest with you, I would share my experience. I am pretty skeptical at first,
Yeah,
especially it's social media, a lot of, scams that out there. You just don't know if the algorithm just shows you because you happen to click one thing there and then everything showed up. But for me, the I think the difference with me was first, I really love my health. I have a lot of things to do and stuff like that.
yeah,
I want to stay active. Second is my mindset that, I know the program is basically you're not sure what you're going to have. It's like a box of chocolate, right? Like the what they call the Tom Hanks movie
yeah,
or stuff. You don't know what you're going to get.
yeah,
For me, I was just fortunate. I'm gonna say blessed that I get across your program. That helped me. I think that's one thing. You have to try. You have to test the water first. I mean,
yeah.
being a skeptical person, you know, with this kind of for me, I'm pretty desperate. I think desperation is the key. I was pretty desperate to get better.
Yeah.
If you're really desperate, for all those people out there, if you're desperate to get better, you're gonna get you're gonna get to try everything.
Yeah.
And, and just that, I think that's the key thing for me. It's desperation.
But day one, I told you 2 things. Don't miss a day, and then communicate with us. You did both of those things, brother, and that's why you were really successful. I really appreciate you kinda taking all that stuff and sharing your experience with us, man.